Hi, this is Dr. Dunphy. I'm an orthopedic surgeon at Hoag Orthopedic Institute and Newport Orthopedic Institute. I'm one of our sports medicine surgeons, and I specialize in shoulder, knee, elbow, hip disorders, mostly on athletes. So how can you tell if you have a problem in your shoulder, especially if you're a pitcher? One of the things that pitchers have that creates a lot of force and torque is external rotation. So if you measure your arm at home, you can see if you're throwing arm versus your non-throwing arm, you should see a lot of more motion external rotation. When you rotate through, that's your internal rotation. A lot of pitchers have lost internal rotation. So when that happens, it's putting a lot more force on the shoulder and actually the elbow. A few easy exercises you can do, you can Google these, look them up yourself, is something called a sleeper stretch. That's a stretch where you're actually on your side, and basically we're trying to get that shoulder to rotate in more. That can help stretch out the posterior capsule, put less pressure on the labrum and the rotator cuff. Additionally, same thing would be a cross body stretch, where you try to bring your arm across your body, stretching out the posterior capsule. Those are two easy exercises you could do at home that can help loosen your shoulder, hopefully improve your mechanics. So I get a lot of questions. When is it time to send in a throwing athlete to be evaluated by an orthopedic surgeon? So usually I rely on my trainers at the school. They see all types of injuries and they kind of get an idea of what's problematic. But a simple way of thinking about it would be, if this injury has happened acutely, like you had one pitch, you're throwing, and wow, I can't lift my arm anymore, that would be a sign to go see an orthopedic surgeon because you had a dramatic loss of function. Usually it's more a progressive thing where it takes time to develop, and after throwing you get sore. If you shut down the amount of throwing, decrease the volume, decrease the number of throws per session, that should fix most problems. An anti-inflammatory like Aleve or Advil also is helpful. If those things aren't working after a period of 2 weeks, I would say get a referral to see us, and we're happy to take a look at you, do an examination, get some x-rays, and see if anything's more serious.